This week it's Mental Health Awareness Week, and this year's theme is anxiety. What is anxiety? How do we manage it? When should we be worried about anxiety? How can we help others with anxiety? Hopefully this podcast will have all the answers for you as I interview Amy Francis.
Hi Sarah, thank you. My name's Amy Francis. I'm a psychological therapist and service lead for iTalk, which is an NHS talking therapy service in Hampshire.
And Amy, I think the best place to start is, what is anxiety?
Yeah, absolutely. So anxiety is an emotion or a feeling, and it's really a common reaction to life events. It's something that we all experience. People might use other terms to describe anxiety, such as feeling stressed or worried or nervous, panicky or on edge. So anxiety can really affect all of us. And there are certain times in our life where we're more likely to experience anxiety, such as during periods of transition or change, for example, becoming a new parent, getting married, divorced, retiring. Also, when we go through changes with our bodies or our physical health, such as puberty or menopause, or people with long-term health conditions are more likely to experience anxiety and or depression. But as well as these big life changes, anxiety can also be triggered in response to those smaller sort of day-to-day life events or situations. So, for example, something like an exam or a presentation might cause somebody to feel anxious. Or for some people, it might be going to busy places. And usually when the anxiety is very focused around those particular situations, it usually subsides after that event has passed. And for some people, it might be that their anxiety is centred around a particular area of their life. And that's what's contributing to those feelings of anxiety. Or for other people, it might be that multiple things are causing them anxiety, which can in itself feel really overwhelming.
So, Amy, what does anxiety actually feel like?
Yeah, it's a good question. I think most people will be really aware, I think, of those physical reactions that we get in our bodies when we feel anxious. So, for example, those sensations such as our heart racing or breathing faster, feeling sweaty and hot. Some people describe those butterflies in your tummy, or the urge to go to the toilet, or feeling sick. But there are also other symptoms of anxiety that we might experience, such as that sense of dread, or that we feel on edge a lot of the time. Or we may even notice changes in our sleep or our appetite. And some of the other sensations, or all of those sensations, can be really uncomfortable or even quite frightening. Sometimes we're able to recognise those sensations as being symptoms of anxiety, but other times we might interpret them as meaning that something's wrong. And it might cause us to worry that we might pass out or have a heart attack, which obviously then is extremely scary. As well as those physical sensations of anxiety, we can also notice patterns in our thinking and our behaviours. So when we feel anxious, we tend to think about the worst case interpretations or think about all the things that might go wrong. Behaviourally, we might seek to avoid situations such as cancelling plans or only going to the supermarket when it's quieter. Or sometimes we might seek reassurance, either by asking those around us or checking things more than usual. And we do all of those things to try and help ourselves feel safer and to feel better. But one thing we know from working with people within therapy is that although those things can help to make us feel protected or safer in the short term, they can sometimes actually work against us by making it harder for us to do things in the long term, and sometimes keeping that problem going. So within therapy, one of the things that we would do within cognitive behavioural therapy is we would try and understand those thoughts and feelings and behaviours, and really look at some of those patterns and what might be keeping it going. And one of the key things that we might try to do is understand that although it's a normal human response to feeling afraid is to want to pull away and to escape and to avoid, but we would really try and look at how can we break this down and help this person to face their fears by sort of breaking it down into small manageable chunks, so that actually they're able to increase and build up their comfort zone again and start to regain their life.
I think that really helps. I think what you've just said there really helps people to understand anxiety, but also understand that you can't really, it's best not to run away from it. It's best to try and work out ways to manage it, isn't it? So, yeah, that's good. So it sounds like most people will experience some anxiety of some sort in some shape or form in their life. So when should we be worried about our anxiety?
Yeah, it's a really good question. And I think, as we know at the moment, there's an awful lot of things going on. We're coming out at the back of a pandemic, which has impacted us in many ways. We're also currently navigating some really trying times with the cost of living crisis and global events. So I think it's really common that we are experiencing some anxiety and some worry at this time. I would really encourage anyone who's feeling anxious or worried to talk to somebody about it. So whether that's a parent, a family member, a friend, a colleague, health professional such as your GP, or to access information online through NHS websites. But I think if you're noticing that your anxiety or worries are becoming more persistent or severe, or that they're having an impact on, say, your ability to do day-to-day things in your life, then I think that's a sign that you might benefit from some further treatment. I think whether that's medication or talking therapies, and I would really encourage people, if they are finding that anxiety is stopping them doing things or really impacting their enjoyment of things that they've previously enjoyed in their life, to talk to their GP and consider referring to a local NHS talking therapy service. I think one thing that's really important is to seek out that support early, because I think sometimes people can feel a little bit hesitant to seek help or to speak to somebody about it, and can worry about opening up or sometimes even dismiss those worries as being something that's normal. But I would really reassure people that they're not alone in those feelings, and that there really are things that can help. And I think there are various different treatments that might be helpful. So sometimes talking to somebody about what might be right for you would be really, really useful.
And so what sort of services do NHS Talking Therapies, like, where you're working, offer?
So there's a real broad range of treatments that are offered within NHS Talking Therapies. So we offer evidence-based psychological therapy. So the main one that we use is cognitive behavioural therapy, which some people might be familiar with. And what we aim to do within that therapy is really to try and understand some of the thoughts and some of the feelings and physical sensations and behaviours that might be maintaining somebody's feelings of anxiety and just keeping them a bit stuck. There's different ways that people can access psychological therapies now. So as well as sort of your traditional in-person therapy, we also have online support where people can access in the comfort of their own home at a time that's convenient. And we call that computerised cognitive behavioural therapy. And that's available for people to access straight away. So people can go onto the website and book straight onto that. There are also groups that can sometimes be really helpful. And I think the feedback that we've had from our groups is that people find it really useful to be in a situation where other people understand their experiences, and to really know that they're not alone, and to be able to share some of their own experiences with anxiety, but also those of others. And I think one that's really useful just to mention is obviously our Managing Moods course, which is 6 weeks long, which is really about learning some helpful tips and techniques to support and manage your own anxiety. But we also have a sleep workshop, which is we've recently developed and we've started. And I think sleep's a really important one to mention today, because our sleep can be impacted by our anxiety, but can also affect our anxiety as well. So I think it's a bit like the chicken and the egg. I think it's one that lots of people would benefit from. And I think just other therapies as well as CBT that we work with, which are really useful for anxiety, things like mindfulness-based cognitive therapy.
So how do people get in touch with this service? Is it via GP or can you self-refer?
So either. So people can either have a referral from their doctor. We can be contacted either by the website, which is www.italk.org.uk, where we have lots of information about different treatments and what might be helpful. Or people can email directly info@italk.org.uk, or contact us on our referral contact number, which is 02380 383920. And we do have our team there who will be happy to support and talk to people about what the options are. Now, some of those treatments can be booked directly on the website, and other ones you may want to speak to somebody and have a telephone assessment initially to talk through what your options are, and one of our team will be really happy to help.
And what was the website address again, Amy?
So it's www.italk.org.uk.
Great. And just on a personal note, and you don't have to answer this, but what do you do about when you're anxious? What's the best sort of top tip that you would give anyone that is anxious at the moment?
Yeah, that's a really good question. I think, as I said earlier, we all experience anxiety at any point in our life. And I think certain things that I do for that in the moment, sort of how to manage my anxiety, would be around just reminding myself that this will pass. I think sometimes when you're in it, it can feel incredibly overwhelming when we've got those physical sensations taking over and our thoughts might be sort of flooding in, and our body everything's telling us to run or escape from that situation. I think just taking a breath and reminding myself that it will pass. And I think on that note, breathing is another really important technique that I personally use, is just to remind myself to really try and slow down my breathing, because I think when we do feel anxious, we tend to breathe more quickly. And I think really just noticing that in-breath, but really focusing on a nice, long, deep sort of exhale breath. And how I remind myself of that is that in has 2 letters and out has 3. So I always think make your out breath that longer breath when you're in that situation and you notice that anxiety creeping up. It can just help to sort of reset you in the moment.
Oh, what kind of feedback do you get from people about the courses they attend?
Yeah, I think we've been going for over 12 years now. So in that time, we've run a lot of courses and we've helped lots of people individually. And I think one of the things that I'm always really humbled by is the impact that it has on people's lives. And I think sometimes people have experienced these difficulties for long periods of time, and knowing that being able to make some of those small changes to either the way they're thinking or how they're approaching managing their anxiety really does have such a positive impact on their life. And I think one thing that I always really love to hear when we get feedback from the people that we work with is that they've got they leave therapy with almost like a toolkit, and they sort of take that onto their life after the session's finished, because really therapy is just there for a really brief period to help support people to carry on with their day-to-day life outside of the sessions. And I think therapy in itself can be incredibly empowering, because really the change comes from the individual doing the hard work. So although the therapist is there to guide and support, it really is sort of a teamwork in terms of the patient going away and applying those techniques in their life that makes the big difference.
And you kind of almost customise your own toolkit in that respect, don't you? Because you take away bits that are going to help you deal with certain situations that you face. Excellent.
Absolutely, yeah.
So thank you, Amy, for joining us today. It's really interesting to hear your thoughts and understand a lot more about anxiety, and to also direct people to the website, which is www.italk.org.uk. Thank you.
Thanks, Sarah. Bye.